my waistline's going to take another hit with this series of Bake Off. You know, not that I'm complaining, we should stress that. But as you say, this portrayal, Matt Lucas' portrayal of Boris Johnson has ruffled a few feathers, and I imagine that my next guest might have something to say about that. We hear at almost every coronavirus press briefing that the government is being led by the science in terms of the restrictions in place and the measures being taken. My next guest is very critical of that approach. Writer and Mail on Sunday columnist Peter Hitchens, you're very welcome to the programme.
Pleasure to be with you.
What was your thoughts on Matt Lucas's take on Boris Johnson?
Well, I have to say I haven't seen it, but I think it'd be very, very hard for any caricature of the Prime Minister to be more ridiculous than the real thing.
He's got the hair right. I'll definitely say that. He's got the hair right. For you, you're not the only person speaking out against the government approach to the handling of the pandemic. Indeed, our own MP here, the DUP, Sammy Wilson, has been very vocal on his views on masks and restrictions. But tell us, what is your main issue with the way things are being handled at the moment?
And my main issue from the start, and I began criticising this in early March, is that the government's actions are out of proportion to the danger. Now, there is a danger, there is disease, there's no question, and people have tragically died of it, and we must all mourn and regret that and wish that more efforts had been made to save them. But I do not think that closing down the entire country, making an actual rather vigorous attack on an already weak economy, or severely restricting the liberties of millions of people was ever the answer. It might have been the answer had we been facing something like the 1918 influenza pandemic, which was genuinely a pandemic. This seems to me to be much more of a panicdemic, where an outbreak of some importance was treated as if it was a major plague by a government which panicked and which has never been willing to admit that it panicked. And so it continues to double down on its mistake and will carry on doing so until it admits that it panicked. And now it keeps moving its objectives, first of all, to flatten a curve and to save the NHS from overload. Now it seems pretty much to have committed itself to extirpating the virus completely, which is almost certainly impossible, and will leave us, if this goal is pursued, under some sort of shutdown and restriction forever. I just think it has always been a matter of proportion, and the response has been wildly out of proportion to the problem.
But when you say that the government has panicked on the issue in their response, I mean, the UK is not the only country in the world to take the coronavirus pandemic with incredible seriousness. I mean, this is a global issue.
Well, you call it seriousness. I don't call it seriousness. I do call it panic. The original reaction of the government was much more similar to Sweden's, and then suddenly they were given these projections by Imperial College, by a group which had actually a reputation for being perhaps slightly alarmist. They didn't look anywhere else or seek any other advice. In fact, they specifically ignored the advice which was coming from other epidemiologists, particularly the very distinguished Oxford professor Sunetra Gupta. And they plunged into this cycle of close downs and mass house arrest, and as I say, the almost total destruction of large parts of the economy. What other governments did was in many ways similar to this, but not all governments did it. The Swedish government, as I say, did not do it. The Japanese government, in fact, didn't do it. And formally, the Japanese government introduced various measures, but the constitution prevents them from doing what we did, and they didn't do it. And generally, Japan's economy stayed more or less alive. And when they began to see the damage that even a small squeeze was doing, they abandoned that. And the number of deaths in Japan has been mercifully extremely small. So whatever anybody can say about this, and if you look around the world, say, comparing the relaxed attitude of Brazil to the stringent attitude of Peru, for instance, or the relaxed attitude of Sweden to the stringent attitude of Belgium, you won't find any congruence between these extremely severe shutdowns and the outcome. The outcome doesn't seem to be affected by it at all. So it's the fact that lots of people made the same mistake doesn't mean it wasn't a mistake. But I can't see any evidence that it was anything other than a mistake.
But we are hearing even today that cases in Sweden are rising and that tighter restrictions are being considered in Stockholm.
Well, cases, what does this mean? I mean, the word is used as if what we had here was somebody who was seriously ill. What we're actually recording is positive tests. Positive tests which are being taken because of an increased effort to make people take the tests. And why people can't make the simple deduction from this that the more tests you have, the more positive tests you'll have. I can't see, obviously, the more you test, the more of these results you'll get. The question with any figure is, what does it mean? In this case, what it means is we're testing more thoroughly, largely among people who are healthy. The other simple point about this disease has been from the start, it's been devastating to people over 75, particularly people over 75 with serious underlying other conditions. But it has not been devastating elsewhere. The number of people who've died from it has been actually quite small, who have not been either very old or with underlying conditions or both. And you can have coronavirus or a positive test for it, and not much will happen. Why would you, as a reaction to that, close down the economy which is actually the basis of health? We're always being... People like me who object to this are always being slandered as putting money before life. The economy isn't money. The economy is the thing in which we live and move and have our being. It's how we live. If the economy goes, you must have been to poor countries, I certainly have. All the things we rely on, it's a very sophisticated taxpayer-financed health service, high quality of clean water, control of pollution, better housing, all the things which contribute to good health, they vanish in a poor country. If you destroy the economy, you destroy health and you destroy life. And there's also very strong and growing evidence that large numbers of deaths have taken place, deaths which are outside the normal, statistically accepted, which cannot be attributed to COVID, and which many people are beginning to suspect are the result of the shutdown. They're not the result of COVID. They're people particularly old and healthy people whose previously happy and active lives have come to an end, people separated from their nearest and dearest, or people who've been too afraid to seek treatment for cancer and heart disease. These people have died in quite large numbers. And I think that when the audit is eventually made, we may well find that the government's measures led to more deaths than they prevented. And it's a matter of proportion. Is this justified? Is the action that we take justified? Always you must ask that. That's the whole purpose of government, to work out what is justified and what is not.
But this virus is new, and we are learning more about it every day. And the government is advised by SAGE, the collective scientists from many places, including Oxford as well. What do you say to the argument that when faced with civil liberty and preservation of life, that the government are right to opt for the latter? I mean, are they better safe than sorry, if you want to put it that way, that one death is too many?
I don't personally think the two actually conflict that much. And you could, look, there are several things. I personally loathe the motor car and wish it had never been invented. And it's absolutely true that if people gave up driving, then huge numbers of lives and injuries would be prevented. But I recognise, because any sane person must, the way in which our society is designed around the motor car means that banning motor cars and banning driving would destroy large parts of the economy, lots of people's livelihoods, and make it impossible for people to do what they do every day. So it's an absurd solution. You have to look again at the proportion. And there has never been in any epidemic or pandemic or outbreak of any kind before, a government which has quarantined the healthy. What you do is you quarantine the sick. And this is a complete inversion of every previous policy. It's not to say the government shouldn't have acted. There's a lot of arguments to say the government should have done a lot better in the care homes, where it seems to me that a very considerable mistake was made, and things were not done which should have been done, and were done which should not have been done. So it's not a matter of saying any action is good. You have to judge what the action is. Was it worth this attack on civil liberties to do? To achieve what we achieved? Well, the answer is, since we almost certainly achieved nothing by it, it wasn't. Governments should be cautious, especially about doing things which are irrevocable. If you went to a doctor with a rash and he said to you, well, I can cure that rash by cutting off your leg, I reckon you go to another doctor. And it might well be that he cured the rash by cutting off your leg, but wouldn't it be too high a price to pay? And here is the problem. This is a government which, as I say, has acted like one of those stupid people who has no sense of proportion. The man who burns down his house because there's a wasp's nest in it. The reaction has been grossly disproportionate.
Well, what would you say a proportionate response would be then?
Well, I think that to some extent the Swedish example is a good example. I'm not going to argue with people who say that social distancing is worthwhile and all the rest of it. But the problem you have to remember is none of these actions actually gets rid of the virus from among us. All they do is they slow down and limit its spread, and that spread then takes place later. So whether any of this has done any good, I'm not sure. I'm perfectly prepared to undertake sensible, reasonable action, such as Sweden took, because they don't destroy the economy or cut society to ribbons. But I'm much more hesitant about taking actions such as the ones our government took, which immediately began a process of destroying jobs. I don't know how many people you know who have lost their jobs as a result of this, but I get increasing numbers of letters and emails from people saying this has happened to them. I know of businesses which have closed down as a result. These are businesses which people loved and worked on for years, mortgaged their houses to support, and they've just gone, wiped out by this. And this is irrevocable. You can't get it back. Rishi Sunak may have lots of magic money, but he doesn't have a magic wand to replace the jobs that should have been destroyed. They've gone forever. Irrevocable action needs especially careful consideration. I don't think it got that consideration.
But we are in a situation where by being in quarantine or by being in lockdown, whatever way one wants to look at it, that by taking yourself out of the equation as much as one can and delaying that, as you say, because it doesn't make it disappear, it just pushes it a little further down the road, that would hopefully bring us closer to the idea of a vaccine or a cure. And with the issue in Sweden being that if that kind of herd immunity strategy was applied to the UK, which was originally discussed, of course, that it's quite an ask, I think, that to put it to people that you can either suffer some lockdown and restrictions on your civil liberty, or we're asking you to take a risk which will lead you to getting this virus and potentially dying of it.
Well, people are taking unconscious risks all the time. In 1968-69, 80,000 people died in the United Kingdom of Asian flu, which is far higher, I think, than any count of COVID-19 deaths. And the government was aware of this, and it was reported quite widely, but it was never at any time suggested that the economy should be shut down or people should be confined to their houses to deal with it. In many years, influenza, and before you say COVID is not the same as influenza, I know, but there are similarities in the way that it sweeps through society, particularly in winter. In many years, certainly the British National Health Service comes close to being overwhelmed by, in what are called winter crises, by large numbers of influenza deaths, quite comparable. There's a very interesting website called In Proportion, which will give you details of this, quite comparable in the terms of deaths to what's happened recently. And that no one has responded by saying, okay, well, let's shut down the country. You have to work out what you can live with and what you can't live. And the simple fact, I remember saying it at the beginning of this, the simple fact that in the United Kingdom, 1,600 people die every day. Every one of those deaths are tragedies of those involved, but it happens. Became almost blasphemous to say it, because we seem to have settled on this sort of ridiculous belief that somehow death can be prevented in our society and disease can be totally prevented. Neither of these things is true. A vaccine would be wonderful if it worked, but vaccines often take many years to develop, and there are several people who look at the coronavirus and say they're not at all sure that an effective vaccine can be developed. The flu vaccines which are given are often not particularly effective, and one doesn't want to rush into vaccines which have not been thoroughly tested, because this can be risky. So I wouldn't put too much weight on that. The idea of waiting for a good vaccine to be available before we come out of this self-imposed self-harm period is horrifying to me, because it could be years. We have to learn, I think, to live with a reasonable level of risk, because we simply cannot cocoon ourselves to such an extent that we're safe from all risks. Almost everything is dangerous. I ride a bicycle every day. It's dangerous, but the benefits are so great that I accept the danger, and I think a lot of other people in their lives do the same thing.
You talked about reasonable responses, and you'd be happy to comply with what you would perceive as reasonable restrictions. And one of the things that we're constantly told about is mask wearing, and I know that that's something that you are not in favour of. Why not?
Well, if people want to wear masks, then that's their affair. What I'm against is compulsion, because I don't think the scientific evidence supports compulsion. On the contrary, I don't think there's any hard scientific evidence that wearing loose cloth masks of the kind which are almost universally worn by the public does any good at all. It's arguable as to whether surgical masks, which simply couldn't be worn universally by people for lots of reasons, discomfort, expense, the constant need to change them, that they might be more effective. But the fact is that there is very little reason behind this, and the government itself and most of its medical and scientific officers and the World Health Organization have all been on record saying, actually, masks are not a very good idea. And they were suddenly adopted as a policy round about the time that the virus had reached its weakest point, and hardly anybody was either dying from it or going into hospital from it. That was the point that was introduced. It seems to me to be much more a measure of control and a measure of continuing the atmosphere of alarm than a health measure. So, as I say, if people want to wear masks, I wouldn't in any way stand in their way, and that's their business. But compulsion on such scanty evidence seems to me to be unjustified.
Peter Hitchens, thank you very much for joining us this morning. And you can, of course, read Peter's column in the Mail on Sunday.